CBS News medical contributor Dr. David Agus joins us now. David, good morning. We heard Dr. Fauci talk about little spikes that could lead to outbreaks if we reopen too soon. Are we prepared right now for little spikes?
It really depends on where you're looking at. I mean, if a state opens when they have hundreds to thousands of cases ongoing or being diagnosed regularly, they can't contact trace them all, and there's the potential for a significant outbreak. So states really need to be on the decline and a number they can handle. There will always be cases after opening a state, and the hope is the strategies laid out can actually contain those cases so it doesn't spread like wildfire. The CDC report that wasn't released had exact methods to do this. My certainly hope is the states enact measures similarly.
Is there enough science, David, around how to safely reopen restaurants, say, and businesses? Or do we really need national guidelines here?
I certainly think national guidelines make the most sense. I mean, I think there's plenty of science. The problem is enacting that science is different depending on who the health commissioner is, who the governor is, and not all of them have the same understanding of the science. I think that we know what interactions are required for the virus to spread, and we can do everything in our power to prevent those interactions when we design how the restaurant is, design how the servers work, design how the chefs work. We can actually put together a plan that dramatically reduces risk, not to zero, but it dramatically reduces spread at these businesses that need to be open. And so my hope is that we all follow these templates, and that the templates are public, and that most states or all states actually go along with them. It would be great.
Right. The death toll, meanwhile, David, is now past 80,000 in the coronavirus. Dr. Fauci said that he believes it's actually likely higher than that. What exactly does he mean?
Well, early on, obviously, testing was limited and difficult, and many people were dissuaded from going to emergency rooms. If you don't have these symptoms, we want you to stay at home, was the message for many weeks, and people died at home. We don't have documentation that they have COVID-19, but the likelihood is that many of them did. So when you look at the numbers, particularly in cities that had large outbreaks, New York City's and others, is that those numbers are dramatically underestimating the numbers of deaths. So whether the number we have now is underestimated by 10%, 25%, or even 50% is really unknown. But I think it's clear that those numbers are underestimated.
All right. Every time we talk, David, we ask you about the progress of a vaccine, because obviously that's the answer to all this. But and Dr. Fauci said he's optimistic at this point. What are we seeing? What's the latest from what you know?
I'm optimistic also. I mean, I've been able to see some of the data from the existing human trials with some of these early vaccine entrants. And what we're seeing is there are immune responses. The hope is that, well, we know over the next several weeks, we're going to know a lot more. And are these immune responses robust enough to provide an immunity? What's going to be interesting is, we vaccinate populations now. At 2 years old, you get this. At 3 years old, you get this. At 65, you get the pneumovax. And at 50, you get the shingles vaccine. This is going to be vaccinating people across all age groups. And so the question is, are we all going to respond the same? And it may be that certain groups get 2 shots to get better immunity. Other groups get 1 shot. That's what's happening now, is we're starting to learn about the heterogeneity, the different responses from groups to these vaccines. There's a lot of science to go, but there certainly is data being collected that gives us cautious optimism that we will have a vaccine, and hopefully not too far away.
If an effective vaccine is developed, David, quickly, do you think it should be mandatory?
I think that's going to be the open question. We need herd immunity to be above 90%. If everybody steps up and is vaccinated, you're not going to need to make it mandatory. But there are many people in the population, the elderly, the cancer patients, autoimmune patients, kids, babies, that aren't going to be able to make a potent enough immune response. So unless we vaccinate a large percentage of the population, over 90%, they are at risk for getting the virus and potentially having serious complications. So we all have to protect each other. So we have to find some way to get herd immunity higher. Likelihood is it may be something like a vaccine mandate. We'll see.
All right. Dr. David Agus. David, thank you. Gail?